Project titled 3D printed prosthetic heart valve. 3 and RAM. Jacob. So I'm gonna keep the slides in this view. Maybe expand it a little. Okay, so what I have is the content page right now. We're looking at the abstract introduction will comprise description of device, purpose, use, construction details, further details on biocompatible and design function application. Hazard reports, we're going to use an ISO standard, good practices for 3D printed prosthetic heart valves, conclusion, and some reference. So in the abstract, we are going to describe heart valve replacement. These are the life-saving interventions for millions of people who suffer from dysfunctional heart valves. Prosthetic heart valves are globally valuated at around 8.71 billion in 2024. These valves are available in different varieties such as mechanical for the traditional types, transcatheter and biological, or we call it animal heart valve replacement, for replacement procedures and repair procedures. So in this article, we are going to introduce the potential of 3D printed heart valves made from special copolymers. Early tests suggest good tissue compatibility, potentially eliminating the need for blood thinning medication and a growth potential with some designs incorporating the patient's own cells, allowing the valve to grow with the patient. So here's the introduction with description. So we know now 3D printed heart valves into the medical field opens new doors for patients with a revolutionary approach. This is an emerging technology holding a bright future through materials that are biocompatible and can even use patients' own cells. Heart valve replacement extends lives and affects millions of people worldwide. Prosthetic valves are globally projected to increase by 2032 and evaluated at 20.43 billion, also found in Table 1. Heart valves acts as a one-way door for unidirectional blood flow to ensure no leakage, backflow, some might say regurgitation, within the four chambers of the heart, divided at the upper atrium, lower ventricles, to enable efficient blood circulation throughout the body. These valves are located at the tricuspid valve, right area, between the atrium and the ventricle, pulmonary valve between the ventricle and the pulmonary artery, and the left valves are bicuspid or mitral valve, located at the atrium and the ventricle on the left side, and aortic valve between the ventricle and the aorta. Following figure 1. The durability of 3D heart valves exceeds established standards. So traditional standards suggest 10 years, and for 3D printed heart valves, we are looking at up to 25 years. So here is the table one and figure one we have so spoke about. At 2024, 8.71, and these are all in USD billion. And in 2032, 20.43. On the right image, we have the heart and the four chambers, the atrium, ventricle, yes, right and left. So we are going to start from the right side. The right side is the pulmonary, so it's where breathing, the air replenishes the blood, oxygen replenish blood. So we are looking at the right atrium to the tricuspid valve. So blood will flow through into the right ventricle and exit through another valve, the pulmonary valve, and the pulmonary artery flowing through. In the left side, we have the left atrium and flowing through the mitral valve or bicuspid valve onto the left ventricle and the aortic valve, exiting at the aortic valve and to the aorta for systemic circulation. Okay, here's the purpose. The purpose is to replace diseased or damaged heart valves. The 3D printed valves are a functional alternative with higher durability after 25 years. Second, lowers the risk. Second or third valve replacement surgeries. So after the first valve replacement surgery, traditional prosthetic heart valve may require resurgery. So this valves include the mechanical, the transcatheter, or the biological, and it's set 10 years at every 10 years. Okay, so we have tissue generation to form living valve through the walls of the valve, porous scaffold where the patient's own tissue can grow, an option for stem cell in valve scaffolding, which integrates with the body and potentially eliminates the need for repeated surgeries, particularly for children. To restore proper blood flow through the heart, leaflet controlled blood flow. Improve flow regulation and reduce the risk of blood clotting in the valve. Improve immune response and reduce the risk of prosthetic valve rejection. Reduce the overall reliance on medication for the intermittent long-term physiological complications. These complications include the blood clots and fluid in tissues on valve. So, blood pressure tissues, arrhythmia, irregular beating of the heart, arrhythmias. Medication following medical news today suggests antiarrhythmias, ACE inhibitors, and ARB, along with ARB, anticoagulants or beta blockers, and vasodilators. Increased patient candidacy through biocompatibility, particularly in young patients. So let's return to the point 8. ACE is angiostensin converting enzyme inhibitor, and ARB is angiotensin receptor blockers. So these are medications commonly prescribed for hypertension. So essentially, they would relax blood vessels relax the blood vessels. Okay, so we're going to go to the next slide. Use. Here's the use. The use is to treat heart valve conditions such as stenosis, narrowing, regurgitation, leakage, or congenital defects. Stenosis occurs when heart valve narrows. Blood flow restricts from one chamber of the heart to another. 3D printed valves can replace the narrow valve and restore leaflet control blood flow. Regurgitation is leaky valve. This leaky valve causes blood to flow backward within the heart. This is the condition. And the 3D printed valves can provide a competent seal and restore leaflet control blood flow. Prolapse is the heart valve leaflet bulges backward into the upper chamber during heartbeats. 3D printed valves with their potentially more durable structure could offer a solution for some prolapse cases depending on the severity and specific cause. Arterial. Arterial is known as block valve. 3D printed valve replacement enables continuous endothelial cell growth and restores leaflet control blood flow. Congenital heart defects, also known as birth defects, relating to arterial, affecting the structure and function. So 3D printed heart valves offers patient-centric designs through digital imaging to produce model of the heart valves already within the patient for children born with these conditions. So for patients who require valve replacement, traditional valve does not provide long-term or permanent solutions. Firstly, age. As the traditional valves is not durable for young patients. Secondly, so when they grow old, the valve doesn't transform with their body's growth, right? Second is the blood thinning medication given that 3D printed valves may reduce the clotting effect, the risk of clotting due to continuous endothelial distribution in the valve scaffolds. Okay, so the patient's own tissues grow into the scaffolds. Okay, so we have construction details in table 2, aortic valve in 3 studies. The first artifact describes or is entitled Researchers with 3D print regenerative valves that grows with patients. In this article, the technique is used print melt printing melt electrowire writing, which uses molten polymers to create microfibers. Although the article mentions that researchers use biocompatible polymers, the specific material used for 3D printing the valve scaffold was not mentioned. In the second artifact titled Using 3D printed models for planning transcatheter aortic valve implantation in patients with bicuspid aortic valve, the material used for 3D printing the valve was not mentioned. In the third artifact, titled New Artificial Heart Valve Could Transform Open Heart Surgery, in Table 2, highlights the poly valve is made from special copolymers. This is done by combining two monomers monomers that are building blocks for polymers. All three artifacts does not specify the specific materials used. However, from contemporary research, biocompatible in 3D printed heart valve may include polydiranes, polydilene glycol, and novel biocompatible copolymers. So The further details on biocompatibility. So we look at what was mentioned prior, involving the patient's own cells into the pores. Okay, in each designed to create a living valve. So then the endothelium cell effect grow the growth. So there'll be growth within natural structure. So lowers the risk of blood clots. And the second one is the natural structure of the valve. Designs use the 3D printed structure with pores that allow tissues to grow in. So it's not just the imaging, but now is the design with the pores. Okay, and the third one is patient's own cells. Um, Now it's used as a scaffold, so to incorporate during the printing to enable nutrient waste exchange. So further emphasizing on point one. So therefore, it can become an aspect of its own body to integrate and grow with the patient, or an aspect of its own tissue. Function. The role of the 3D printed valve is to provide equivalent function to a natural heart valve using technological innovations. Unlike standard valves, 3D printed valves have tiny pores where patients' own tissues can grow, where when patients' tissues grow through the walls of the valve, this may theoretically create a living valve and designed to function longer than prosthetic valves. Theoretically, because we would see from case to case whether the body, uh, patient's body accepts and the tissues actually do grow or do not grow from case to case into the valve scaffold. This innovative procedure ensures that the future valve replacement surgeries are reduced or sometimes not required with the same patient. Current procedures involve replacement mechanisms that are completely removed, removing the disease valve and implanting an artificial one, and repair mechanisms aimed at restoring proper function of the native heart valve leaflets. For new artificial heart valves to be ready for human use, they must pass a durability test by enduring no less than 200 million openings and closing cycles during trials that last 5 years in laboratories. Application. There are four valves, namely aortic valve, mitral valve, bicuspid, yes, and pulmonary valve, and tricuspid valve. Each valve contains leaflets, cups, which opens to allow blood flow and closes to maintain unidirectional flow, one-way flow. Okay. Disease valve inhibits regular blood flow through the body. Prosthetic valves are used in patients with various heart valve conditions. Mayo Clinic suggests four diseases found in adults. This includes stenosis, regurgitation, prolapse, Ezria. In this section, five diseases are reflected, detailing, or these detailed includes the congenital heart valve defect. So the fifth one is a defect. And stenosis is the narrowing of the valve opening with the cups becoming thickened, stiff, or scarred, obstructing blood flow. Regurgitation is leaky valve, valvular insufficiency causing backflow. Prolapse is posterior bulging of the valve, leaflets also leading to regurgitation. Atrial underdeveloped valve, where the valve was not formed properly, which may appear as a completely absent valve or replaced by a solid piece of tissue. Congenital heart valve defects. So this is similar to atrial, where the valve is not fully formed or absent relating to form of function. Okay, so here is the table 2 with aortic valve in 3 studies. And we have the first one. Researchers print 3D regenerative heart valves that grow with patient. The second one, using 3D print models for planning transcatheter aortic valve implantation with patients with bicuspid aortic valve. New with the third one, artificial heart valve could transform open heart surgery. And here are the hazard reports. So 3D printed heart valves using ISO 14971 traceability matrix for 3D printed heart valve has a potential risk, including biocompatible issues arising from structural complications from design flaws and infections due to improper sterilization, patient selection, quality control. Longitudinal studies will mitigate these risks and ensure patient safety. So here we want to ensure 3D prosthetic valves offer a safe and effective option for patients instead of traditional prosthetics that include mechanical, transcatheter, biological. For replacement procedures and repair procedures, risk mitigation strategies are to lower risks. Researchers and medical professionals can minimize potential harm of patients during the procedure by addressing weak immune response, tissue death, valve dysfunction, valve leakage, blood clots, heart failure, post-operative infection, sepsis, valve malfunction, tissue damage that are associated with harm. The adapted ISO 14971 table highlights with these few things: hazard ID, description, potential cause, harm and effect and harm, and risk evaluation, risk control measures, verification, residue risk. So here we have the 1, 2, 3, 4, 5. And the first one is biocompatible issues or biocompatibility, tissue rejection or inflammation. Second one is the design flaws or manufacturing defects of the 3D printed heart valve, infection from contamination of the valve, and improper patient selection, followed by longitudinal data efficacy of the 3D printed heart valves. Okay, so for the first one, we have potential cause. So use of incompatible biomaterials, improper cell seeding techniques. Next, we follow in the same row: patient immune response, tissue death, valve dysfunction. So it's high. Developing technology, potential for severe complications. So we have the severity, health at high risk. Okay, and next we have rigorous biocompatible testing, materials development of standardized protocols for cell seeding. So this is the risk control, implementation, monitoring for immune response. So how do we verify? Review the material, testing data, verification of seeding procedures, analysis of post-implant for patient data. So all this will reduce the residual risk, or rather, will still contain risks, and the risk will be moderate. So all this will reduce the risk evaluation. occurrence times severity. Okay. So it's now moderate, cannot be completely eliminated, but mitigation strategies are in place. Next, we have design flaws. So potential cause stress in distribution, so material stress in the structural. Um, Defects in 3D printing process, valve leakage, blood clots, failure. So risk evaluation, it's high, same thing like the previous. And risk control, rigorous structural analysis, testing of valve design, implementation of robust quality control measures, including manufacturer pre-implantation imaging to assess valve integrity. So verification, to verify this, review the design and testing data, inspect manufactured valves for defects, verification pre-implantation imaging results. So this will create a moderate, cannot be completely eliminated, so there's residual risk is in the moderate, that mitigation strategies are in place. Okay, then we have the third one, inadequate sterilization procedures, breaches in sterilization or sterilized technique during implant, post-operative and infection, sepsis. Sepsis is the condition that happens when the body's immune response has an extreme response to an infection. So here, same thing like the previous, is high risk. And at the evaluation stage, the risk control to develop implementation stringent sterilization protocols for valves, training for healthcare professionals on aseptic implant techniques, post-procedure, post-operative monitoring for signs of infection, and verification, review, validation of sterilization protocols, observation of surgical procedures, adhere to septic technique, analysis of post-operative patient data for infection. So again, it's moderate, following the first two, cannot be eliminated entirely, but this mitigation strategies are in place. Next, we have clear or lack of clear selection criteria, sufficient patient evaluation, valve malfunction due to complication, uh, to patient incompatibility with technology. So we're looking at the harm, and then we're looking at the risk, medium, developing technology for potential serious complications, medium. Okay, and so next we are looking at the risk control, develop clear patient selection based on age, health status, condition, true patient evaluation pre-implantation to assess suitability for the technology, ongoing research to refine the landmark on the patient, selection criteria. So verification to review the validation of patient selection criteria, evaluation of patient data to ensure proper selection of analysis, post-implant complications in different patient groups. So this one can be low. Risk can be mitigated through careful patient selection. Next one, we have the fifth, is longitudinal data efficacy. So we're talking about the hazard now. New technology with limited clinical experience, unforeseen complications related to long-term performance or tissue interaction. Okay, so we have the risk evaluation at medium, developing developing technology for potential unknown complications, And at the control, we have continued research, long-term follow-up studies on implanted valves, open communication with patients about the limitations of current knowledge development, registries due to or to track patients with these outcomes with these valves. So we have the monitoring of ongoing research and clinical trials, transparency with patient regarding limited long-term data analysis of data from patient's registry, and the residual risk is low, can be mitigated through ongoing research and transparency. So here is the good practices. So the good practices includes European Union Medical Device Regulation 2017-745. So so here is how they classify the medical device. Just so we look at this in a whole. This is still under development. Some good practices are considered for design, manufacture, and future patient care along with regulatory considerations. 3D printed prosthetic valves are emerging technology. Their regulatory pathway is still being developed. So here we are looking at, once again, prosthetic valves are considered class 3 highest category. 3D valves fall in this category due to nobility and potential risks under schedule class 3. Okay, this is the implant. Okay, and good manufacturing practices, GMP, for 3D printed heart valves. 3D printer is not a medical device, however, the prosthetic valves are to adhere to GMP guidelines to ensure the highest quality and safety throughout the manufacturing process. The 3D process creates the medical device known as 3D prosthetic valves. So the product, the valve, the prosthetic valve is the medical device, and to ensure the process, we look into the next slide. So here is the process for GMP. Traditional is design, development, manufacturing process, quality control and testing, documentation and record keeping, training and personnel, training the personnel, essentially, regulatory compliance. So what we want to look into for 3D prosthetics, 3D printed prosthetic valve is biocompatibility optimization, personalized design, controlled cell seeding, scaffold design optimization, sterilization techniques, and reg compliance. Good practices continued. So there's the ISO for custom-made valves that are essentially modeled and printed based on the patient's heart valve using 3D image. Does not require a CE mark. However, this is according to BSI Compliance Navigator, uh, and this allows for further opportunities in research process of manufacturing instead of certifying the 3D printer itself, which is not a medical device. It itself is not a medical device. So, regulatory approval process. The specific approval processes varies from country to country. Each country is own. It depends on the regulatory body. The traditional methods of collaborating among sponsors, investigators, and regulatory agencies such as FDA for handling intricate clinical trials proposals were indicated by Chen et al. So here is from that article. We have an image. So it starts from concept to prototype, preclinical, clinical, and we have the manufacturing, we have marketing, we have commercial use, and obsolescence, and and then it's a cycle. So here is the FDA novelty solutions for prosthetic valves. Will add to patients options for valve replacement and offer new approaches to 3D printed valves with newer versions being developed. The design materials and manufacturing processes may differ significantly from the traditional valves. So BSI Compliance Navigator mentions medical device regulation (MDR) approval process follows the 510(k) clearance and pre-market approval. Applications is necessary due to the high-risk nature of the device. Substantially equivalent predicate devices makes PM PMA application necessary. Pre-market approval. Okay. Okay, so according to Mayo Clinic, there are two approaches for heart valve surgery. Open heart surgery, a larger incision is made to access the heart directly. This is generally a risky procedure. Second, minimal invasive surgery that requires smaller cuts, offers quicker recovery, less pain, short hospital stay. This is done through thoracoscope, thoracoscopic surgery or mini thoracotomy, where a surgeon uses long tools and perform through one or more small incisions on the right side of the chest or a robot arm assisted surgery. Upon completion of this surgical procedure, the patient remains in intensive care, is closely monitored. Fluids and medications are given through intravenous drip. Tubes might drain urine and excess body fluid. Okay, so with lung surgery, there's urine catheter, etc. With the body fluid drainage. Okay, so table 5 checklist for patient care. Future implementation, pre-implementation. So we look at true or thorough evaluation of patient suitability for 3D printed heart valve, considering factors like age, overall health, and specific valve condition. Inform patient process detailing the potential risk and limitations of the new technology compared to traditional options. This is more specific for adults rather than the child valve heart transplant, and potential harvesting of patient stem cell for later use in valve creation. So this one is when they harvest the stem cells is both for adults and children. Post implementation, regular follow-up appointments with cardiologists to monitor valve function, tissue growth, adhere to prescribed medications to manage any potential immune response or blood clotting bits, advanced imaging techniques, regular examinations, so echocardiograms, anti-thrombotic therapy, appropriate antibiotic, and prophylaxis. This is against endocarditis to assess valve performance and tissue ingrowth over time. Here is the conclusion. So, valve replacement, 3D printed valve replacement is a technology frontier that enables more options for patients with greater durability, potentially beyond 25 years, and biocompatibility to transform a prosthetic valve to become an aspect of its own tissue when it integrates with the body and grows with nutrients and waste exchange. Patients may opt for 3D printed valves as confidence increased with promising scientific publications in 3D printed prosthetic valves that are unique and patient-centered. 3D printed or 3D printers are the instrument to producing 3D prosthetic valves. However, the 3D printer equipment is not a medical device. The greater regulatory compliance and 3D prosthetic valve printing process, such as design, materials, integration techniques through FDA, ISO certification for global harmonization, are necessary as post-market surveillance for longitudinal review. And here is the references and work cited in other sources and work cited. Thank you.